Okay, Felicity Grace, what is that lip balm or chapstick you keep using in your videos lately? It gives your lips a really pretty pink tint. Thank you. You were probably talking about this. Use the Lip Smacker Cotton Candy. That's the thing. I put this on all day, every day. Every day. I love it so much. I've been wearing Lip Smackers since, I don't know, like 2nd grade. Seriously. And I'm addicted. I love it. I love it because it doesn't give that weird taste that chapstick does, like the what is that, like the menthol taste, you know what I mean? Like, I hate the taste of that, and I feel like it ruins everything. It ruins my food, ruins everything. I hate it so much. So I use Lip Smacker, but some Lip Smackers taste horrible too. I hate anything with chocolate in it in the Lip Smackers. Like, ugh, I hate that. That makes me cough. But for me, cotton candy is the best because it does give you a tiny little bit of a pink tint and a tiny bit of shimmer, but it also tastes okay. So like if you accidentally lick your lips or whatever, it actually tastes really good. And so I like this one the best. I used to have a favorite, but they don't make it anymore. It was like a it was one of the sparkly ones, and it was blue, something blue. And it was my favorite, but they stopped making it, so I had to switch flavors to cotton candy. So that's my favorite. But I also love other flavors too, like strawberry and watermelon and blue, and like all kinds of flavors, just as long as it's not chocolate. So and then you also asked, do you feel the urge to restrict your intake now that you have more control and don't binge? Yes, but I am binging now, but yes. Go watch yesterday's video. Yesterday's video where I vented about all of this, I covered this a lot, so go watch yesterday's video. Erica Mancute. Hi Shani, what are you doing all day? Do you sit at home? Because every time when I am at home and not cleaning anything, I don't have what to do, or I don't know what to do, and I get really depressed. Is this happened to you too? Have you ever had a job? Yeah, for me, it's changed over the past few months since I got like really sick, like as in I can barely stand for very long, or I mean, I've been sick for a while, you guys know that, but if you follow me, you know that my health in the past month or two alone has declined severely. And so the past month or two is different than how most of my YouTube career has been, like the first year and a half, almost 2 years of it. So before, I was still binging and purging at least once a night, and so that would be a lot of my time spent when I wasn't doing videos or planning videos or writing or filming or editing or whatever. I was binging and purging, and each session, usually, I'm not the typical binger and purger. I would take my time with it and eat very slowly and enjoy every little bite of food. And my mouth is watering talking about it. I haven't really talked about it. That's weird. It's bringing up like cravings all of a sudden. But anyway, I would just eat and eat for 2 or 3 hours straight, and then binge and then purge. So my binge and purge sessions would take up like 4 hours of my night. So that's where a lot of my time went. And then I also, and this is still true right now, even though I'm recovering from bulimia, I spend an average of 2 to 4 hours on the toilet every day because I have gastroparesis and it takes me that long to poop. I have to do enemas. I have a whole routine I have to do to get it to work, to get my poop to come out. It's very frustrating and it takes a long time. So I basically live in the bathroom. So that's great. And then now, lately, since I've been getting worse, it's been like just trying not to pass out, or just trying to listen to my body. And if my body wants me to, you know, like I don't sleep during the day anymore. Like I go to sleep at night now. Like I'm normal, like I'm a normal person almost. But usually I'll get up in the morning, and then like a few hours after I get up, I feel like I have to take a nap or I'm gonna die. So I go take a nap. So that takes up a lot of time. But it's better that I'm doing that than purging. And so basically I listen to my body lately, because right now it's very crucial. I feel like I'm on the edge and I don't know if I'm going to succeed or if I'm gonna die, and that's where I am. And so I have to like be so cautious with my body right now and listen to every little thing that it wants me to do, and that's what I'm doing, and that's all I can do. So yeah. Okay. And have I ever had a job? Yeah, I've had a few jobs. I was a nanny while I was in high school. It was for my sister, but still, it was a job, and it was a big job. Alexis, my best friend, my niece, I took care of her as a child for a long, long time. That's probably why we're so close. Like, yeah. And then after Danny and I got married, we both worked at a call center together. And then I worked at the mall at a game store, and then I worked at another call center with Danny, a different call center. And then I worked at Robert's, which is just like Michael's craft store. And I was there for, I think, almost 3 years. And that's when I got really sick and I had to quit. And because I had to get surgery and all kinds of things were happening back then. So I just quit. And since then, I haven't really had like a job. Like, this is my job now. But since then, I haven't really had a job that was set, like scheduled, like you have to be here at this time or you're gonna get fired. Like, I haven't been able to have that kind of job because my body is very unpredictable, and you never know when I'm gonna break or get sick or, you know, whatever. So yeah. Okay, let's move on. But I just want to focus on one question that so many of you have been asking me. A lot of you are worried about me getting addicted to the painkillers that I'm on for my teeth and for the process. So for those of you that don't know what I'm talking about, if this is the first video you're seeing of me or whatever, I am missing a lot of teeth, obviously, and it's because of my eating disorder. It has rotted away my teeth and malnourished away my teeth, and now I don't have teeth. So I'm getting the rest of my teeth that are infected and dead and ready to come out anyway, removed in a surgery, and they're putting implants in, and they're putting temporary dentures, and it's a whole deal, and it has been excruciatingly painful for a very long time, and the surgery itself will be painful, the recovery will be painful, blah blah blah. So I have been debating how to talk to you about this, because I know that it's a very sensitive topic with everybody in the world, especially these days. There are so many people out there that abuse prescription painkillers, and those of us out there who are really sick and really actually need them and have the health problems and unbearable pain that only the painkillers can help relieve, we are looked at differently because of those people that abuse them. I don't think that's ever their intention, but that's just how the world works, and that's understandable. So that's why I'm just saying that's why this is hard for me to talk to you guys about this, because I have always felt the need to not talk about it very much, because I felt like I would be judged because of my age, because a lot of people don't believe that I have as many health problems as I have because I'm young and because my skin is great or whatever. Like, I've heard so many things like, your skin is perfect, you're young, you have beautiful full hair, and you are very vivacious and happy and cheery, and that's because I'm real good at faking it, because I've spent my whole life being fake. So it's just abnormal how many health problems I have for my age, and some of that is because of my eating disorder, some is just genetic, and some is just bad luck, I guess, but I do. And so what I want to say first of all is that I come from a lot of people in my life, I'll say, because it's not fair of me to just spew out names or even tell how I know them or whatever. So I'll just say I have seen this addiction destroy a lot of people in my life. I've seen what it can do to them. I've seen what it does to their families. Like, so many people, it's unbelievable how many people I know that are close to me that have struggled with prescription drug abuse. So because of that, I think that's why I have never felt, it's totally like understandable. Like, I've questioned that myself too. Like, well, I'm not doing my old addiction anymore, so am I gonna need something to replace it? Like, are these pain meds gonna just replace it? So like okay, so the answer to the question is, am I worried about it? I'm not worried about it, but I'm cautious about it. Like, I don't think that that will be a problem for me, and here's why. And I've been debating so much on whether or not to tell you guys this, because there are so many people in the world that abuse painkillers. I have had horrible health problems since I was a little girl, a long time. I have had many different health problems. And so throughout my life, I have been on prescription painkillers a lot. And off and on, the doses would change off and on, but mostly it would never get very much. Like, I won't allow it, is what I'm saying. Okay, so I'm getting ahead of myself. So my point is that I have a lot of experience taking pain medications, is my point. And every time I've taken them, I get it. Like, I get the good feeling that it gives you at first, and I can see why people would become addicted. But for me, it's sad, but luckily, thankfully, I have seen, first of all, what it can do to other people and how it destroys their life and their health and their family and their well-being. I can see that, and that's always been a warning sign for me, and that's always been something that I hold on to every time I have to take pain medication. And so for me, it's almost good that I was able to witness that, because it's like I was being warned. And so I've always been extra cautious. Maybe overly cautious. You can't be overly cautious, but I am. I'm very, very cautious. So is my doctor. When I'm prescribed, like, we're very, very cautious and responsible. I have always been responsible with my pain medication. And then the other thing is that, luckily, I guess, they make me extremely sick. And sometimes, you know, that's a good thing, because I can't take too many without it making me sick. So right now, that's why I'm sick all the time, because I am on a higher dose right now, because I am in higher pain right now, and I'm going to be for the next few months. And so I've been taking this higher dose over the last few weeks or month or two, I don't know. And it's like, a lot of you are worried, well, isn't it going to give you constipation and make you sick and tired all the time? Yeah, that's why I've been sick. And as far as the constipation goes, that happens to me no matter what, because I have gastroparesis. But I never get like hard poo. I don't. It's just hard for it to come out, because my butthole has so many problems, and it's always swelling and has fissures and hemorrhoids, and you're welcome. Yeah, so anyway, I've been dealing with this for a long time. I know how they make my body work and don't work and things like that. Like, I'm very, very aware of what I do with pain medication, because I've seen what it can do to other people, and I don't want to be sick. Like, I get sick if I take even a tiny bit too much, or more than I'm used to or have been, or if I go off of them and then go back on them. Like, I'm always sick at first, and like, it's just how it is with me. I guess I just want people, I want everybody to understand that you guys know that I am the most honest person in the world. If this was a problem for me, I would tell you. And I am cautious of everything. Yeah, so I'll probably see you tomorrow for a video. I don't know what it's gonna be, but I'll see you. So I love you guys, and remember forever and always that you are beautiful, you are worth it, we all are, and I am too. And we can do this, and we can get through it, because we're the bestest in the world at the times. And so many people will try to bring us down and attack us for all of the drugs and all of the disorders that we have, and the health and the problems that we all have. But everybody in the world, the whole entire world, has problems, and it's unfair for us to judge each other when we don't know if we're not in each other's shoes. And so maybe if we all just come together and be real nice and does not judge each other, and just feel the closeness and the bondness that we're meant to feel as human beings, then we can all be together and join together in the forces of love and the forces of strength and ability to get through the life of the hard times, so that we can come out even stronger and even better, and become the people that we know that we are capable to be, and to just love ourselves and be beautiful and kind to ourselves and to other people, so that we can feel better about our soul and that our future in our spiritual soulness will be bright and golden, and we will be happy forever and ever in eternity for the times. Okay, so I'll see you tomorrow. You are beautiful, you are worth it, and I am too. I love you. Thank you for watching. Bye.